Hi, ma'am. Good evening. So to start with, could you please introduce yourself as to who you are, what you do, and like who all you live with, etc.?
Okay, I'm Dr. Anupam Goyal. I'm a cardiologist. I am an associate director cardiology in Max Hospital, Saket, Delhi. And I live with my family. My husband, who's a heart transplant and cardiac surgeon with Apollo in the Press Apollo, Delhi. We have a daughter who's studying abroad right now.
Okay. So if you don't mind sharing with us, do you have any medical history?
As such, not much. God's grace, I have been healthy till now.
Okay, that's great. Ever since the pandemic, there have been lots of remedies, and as a doctor, you would know that people are spreading false rumors that particular medicines, like Ayurvedic medicines, prevent COVID or maybe cure COVID. So, do you have anything to say about that?
Yes. First and foremost, there are a lot of information. Whenever there is a tragedy or there is something unknown about which people don't know much, some things are genuinely disbelief. Like people would like to try things which are generally good. Like everybody knows haldi is good, garlic is good, and natural things, immunity boosters are good. Till there, it is okay. But the things which we don't know about, many people can take wrong impressions out of that and eat it and maybe lower down on their safeguard. So this is not correct. Till now, unfortunately, we don't have any Ayurvedic medicine or homeopathic medicine, for that matter, even allopathic medicine, which is foolproof. So there is no definite cure for the disease as such. Now, with the time, like 7, 8 months already in the pandemic, we have some medicines which are antiviral, which we know reduce inflammation, could help in the form of antibodies. But if people have their propaganda that this medicine could cure, this is very unfair to the general public, because then they just believe that they'll be fine with taking this.
Okay. Then, ma'am, also because you in the lockdown, all doctors were working, and since you had to go to the hospital, so were you scared that you could get COVID, or was there any stigma that the people around your house would be like, oh God, there are doctors living here, and they would stay away, or was there any problem you faced with that?
Oh, you're right. One scared, yes. I think everybody's scared, doctors included. And since our hospital jumped in it at the very at the very start of the pandemic, so we had to deal with patients right from the very beginning. Uh, Scared is one thing, of course, which is natural, but at the same time, I'm sure no doctor wants to look away when they are required. So we all wanted to take care of patients. We would take all the precautions, try to be as cautious as possible and take care of the patients. Stigma, unfortunately, you're right. As such, it won't happen to us because maybe we live in better areas. We are relatively maybe at a little senior level right now, but I have heard stories about people who are really working on ground, uh, resident doctors who are really at the forefront of the pandemic, who are taking care of the patients, emergency staff, sisters, ward boys. They have to deal with this, which is so unfortunate. You must have heard the news around AIMS, where Gautam Nagar area, the girls were they were taunted and they were told, you bring back disease. Everybody wants to be taken care of when they are unwell. They want somebody should take care of me. I'm not well. But when the same people who are taking care of somebody else who's not well, they want to stay away. It's sad and bad. And honestly, most of the healthcare workers in this country are at low morale because of these double standards, not only from general people, mostly at every level of society. The administrators, the politicians, general public, they just have, most of them would have double standard while dealing with such things, which is insensitive.
Yeah, and how did the government respond to your needs? Like, hospitals would need stuff, and then, like, how do you think the government has responded to the COVID situation altogether? Like the steps that they've taken and the tests that are happening, all of that.
Actually, it came as a big bad surprise for government as well. So of course nobody was so well prepared to deal with it, though of course everything was tried. Hospitals geared up. I mean, they were given protective kits, and the testing started. Actually, it's both ways. We were low on testing part, but that is also true. Most of the people were not willing to be tested. That stigma comes with it. They think if we are tested positive, we'll have to be in the hospital. And this is a very funny disease. More than 80% people would be absolutely asymptomatic. So it's not possible to go and check each and everybody. Those people who have disease would have sometimes very vague symptoms. So of course they won't go and like to check. But where there have been problems, like people really feel fever, cough, breathing difficulty, they needed the checkup. I think government has done pretty well whatever they could with the magnitude of disease and the population we have at hand. I don't think anything else could have been done. We all need to be with government and authorities on this. Nobody can do things for us. We all are part of the solution. We all have to be. So everybody take care of himself or herself, and that's how we can all control it. There's no other way, no shortcuts.
Yes, ma'am, that's right. How did you manage going to the hospital every day during the lockdown and needing groceries at the same time? So basically, how did you equate your work and your like your other responsibilities at the same time?
The work as such naturally reduced other than COVID.
Yeah.
So the hospital footfalls were less. Rather, it was on the wrong side. Like genuine cardiac patients who needed attention will not be coming to hospital because of the COVID scare. For settled patient who are stable, it's okay. But if a patient has suspected cardiac illness and is not coming, that is very dangerous, because if the heart attack it's not taken care of in time, then there is so much deterioration in heart functioning, and there is nothing much which we couldn't do about it. Like I was telling you about my husband who was a heart surgeon. He had to deal with real bad emergencies because a person has a heart attack, unfortunately doesn't get medical help, and then there is a hole in the wall of the heart. So the thing which was 5% bad becomes 50% bad. So the treatment is more complex, results are not as great, but luckily they did well. But one, cardiac patients were not coming so much. But yes, whatsoever workload was there, it had to be dealt with. We were not very busy other than COVID patients at that time. So it's not that everybody was busy, but yes, staying outside home was very strenuous, because you have two masks on, and 95 has to be there, then another mask, then glasses, and then shield. This you have to be very careful, then you don't touch it. I mean, I won't eat anything outside home till I leave my home with a mask on, and I take it out only when I'm back home. Not even to drink water, I won't take it off. So that part becomes a bit tricky, and then you are scared like you can bring the disease back. Luckily, as you said, we are healthy and can handle it maybe. But like for my father, who just stays nearby with my brother, you can't visit him frequently because you're scared. My daughter was here for 5 months when of course the colleges were off. So you are worried that you might bring the disease back to your own family. That strenuous part was there. It wasn't more of physical exhaustion, it was mental and psychological pressure, which is still continuing, of course. We never realized we'll be so long in this pandemic, but 7 months on and it's still raging. So
Yeah.
groceries and
Is
everything,
there anybody?
big bad part. Good thing is being maybe because we are staying in Delhi, so everything was open. I'm very happy government didn't close down on things or ration the timings like some state governments. That would have been disastrous. If everybody is to move out at one particular go to get things, I'm sure it'll be a bad thing. People will be out at the
Yeah.
same time. Since the shops were open, you are comfortable. You can go out anytime and get your stuff. Just go quick in, quick out, and that should be it.
Okay. So is there anybody in close proximity with you who's been affected with COVID?
Sorry, come again?
Is there anybody in close proximity with you who's been infected with COVID?
In patients, lot of patients in our hospital. My own patients, COVID has one presentation as clots in the heart or brain. So the heart attack patients which we see in emergency, where we can't even waste time checking them for COVID, it happens so frequently. We take them up for treatment. As you finish the treatment, by next day, patient turned out to be COVID positive. Then you are scared shit till next 1 week. What would happen to you and your team, because you had to deal with it at that time? Oh, multiple such scenarios happened in last 6 months or so. So we have seen the disease up close and very, very close.
Yeah, so what have you learned from all this experience? And is there anything positive about the lockdown according to you? Even though you had to go to work and life was pretty much normal.
No, no, no. Life is not normal. Life is not normal. Going is just one part of it, right? Going carefree and enjoying your work, I don't think it is there yet. We have to be still very cautious. The patients have to be a little away. You can't be very close. You can't be comfortable. You can't even talk to your colleagues up close. You are still away with two masks. And the good thing from the lockdown, yes, I think it's good for few good things, like families have come together. I personally believe, I mean, I won't have got time with my daughter in last 2 months since she's joined college. She's in New York, Columbia, doing her college degree. So I could spend time with her. We could spend more time at home. I'm sure most of the families where the parents and kids had to stay together at home, they, of course, staying home together brings you closer to the society. Then I think we all appreciate the value of natural things which we have, being with each other, being happy with things which we never thought we'll be doing without. Going out, enjoying, going to the malls, all this we could do without even bothering. As long as we were safe and comfortable, nobody really bothered. They haven't been out. Most of us didn't bother that we have been out. So the
Yeah.
good part is, yes, it has maybe brought families together. It has given us some intellectual things to realize how blessed we are to have everything normal and natural around us, and we need to value each day, because it's unpredictable world. You never know how it will change. Who would have thought 2020 will bring this?
Yeah.
We're thinking just hop on a plane and go where you want, and here we are, just restricted to our own homes.
Yeah. And is there any advice that you would like to give to us as people who don't know much about the medical department? About COVID as to whether we
Yes,
should go
this
out?
is very important. We all, yes, COVID is one disease which thankfully can be prevented. Being cautious mostly. I won't say that everybody who gets it. Sometimes you don't even know the person who's spreading the disease might not even know, poor fellow, that he has the disease. But if somebody is unwell, has
Yeah.
fever, cough, or any problem, please stay away from everybody else. Be in isolation, have your mouth and nose covered all the time. People really take it like, while you go to the park for morning walks, or where elderly goes, or you go to the market, and some people would be having their masks very silly way hanging around their neck, just below their nose. They think they are being brave. They are being silly. I mean, they are taking everybody else's life at stake, which is not good, because you and me wouldn't know if we are infected for a long time. So if we are not cautious, we could give a disease to the other people who might become more unwell with it. So everybody needs to continue to be very cautious. Whenever out of home, have a proper mask on. Don't remove the mask while speaking, because it's mostly speaking when you generate more aerosols, and the virus might be spread. If everybody is cautious and safe, I'm sure we'll be able to take care of this pandemic soon.
Yes, ma'am. Thank you so much. Stay safe, ma'am.
Okay, all the best. All the best.
Thank you
Take
so
care.
much.